Welcome to Relationship Talk, the podcast where we have real conversations about love, well-being, dating, and relationships. In today's episode, I had an enlightening conversation about perimenopause and menopause with Dr. Polly Watson, who is a board-certified OB-GYN with over 20 years of experience specializing in menopausal, sexual, and functional medicine. She is an expert in addressing a wide range of hormonal concerns, including PCOS, PMS, perimenopause, menopause, low libido, and sexual pain. As a certified practitioner with the Institute for Functional Medicine, Dr. Watson integrates holistic care approaches that go beyond traditional medicine. You can find out more about Polly's empowering work in the show notes. During this conversation, Polly shares some of the most common things women navigating perimenopause and menopause say about intimacy and discomfort during sex. She also addresses a burning question that so many people are left wondering. Is painful sex during this stage of life inevitable, or are there ways to prevent or ease it early on? Polly also tackles that confusing space where you're asking yourself, are my symptoms hormonal, emotional, or something else entirely? Polly brings insights that cuts through the guessing game. And yes, we even shine a light on the upsides of this life stage, the ones women might not always realize are waiting for them. And so much more. You are about to get the whole RLT, aka Relationship Talk, so you are going to want to watch the entire episode. I hope that you will find this conversation as enabling as I did. And remember to subscribe, hit that like button and that notification bell. I'm Teresha Young, your international wellness and relationship coach. Enjoy, take notes, and get ready to apply all key messages you take away today. Hello, Dr. Polly Watson. How are you doing today? Welcome to the show.
I'm great. Thanks so much for having me. What a fun time to have together.
Oh, it really is, particularly because, again, another first, I'm exploring a topic that we have not explored before on this show. So I'm so excited because we're going to be talking about menopause, perimenopause, and sexual pain that can actually occur during that stage. So, Polly, I would love you to share with the audience, actually, before we start getting into the conversation, what led you to specializing in menopausal, sexual, and functional medicine?
So, my mom went through menopause at 38, and all of her healthcare team was really dismissive. They're like, "You're too young for this. This isn't really happening." And um, I was really astonished. I would go to the doctor with her, and I was really astonished. And so, when I was in high school, I had some fantastic science teachers and people that were really supportive. And I'm like, okay, I can do better. I'm going to do better. And then when I went into OB-GYN training, as much as I love delivering little babies, and that's such a magical time, it's a privilege, I really felt like the women in the menopausal space needed more time and attention. So I kind of took a step back. I also sort of need to take a step back as I became a parent myself. And so I just chose to sort of focus on menopausal medicine, sexual medicine really early in my career. And then as that progressed, so I'm 51, I graduated from medical school 25 years ago. So I've kind of had a little journey. You know, I would say about 15 years ago, women were coming in and they were having these garbage bags full of supplements. And I did not know what they meant. I did not know what they were for. Didn't have that in my training. And yet I was their doctor. And so I'm like, okay, I need to go back and get more training. And so I started exploring integrative medicine, functional medicine, and I chose to do certification with the Institute for Functional Medicine to learn more about root cause medicine. And it's just been kind of full circle, but it's nice to have more tools in your toolkit.
It is absolutely, and this is what the intention of this episode will be, is to have that toolkit available because nobody wants to have a garbage bag of things no coming to you, just what on earth is going on. So when women come to you during perimenopause or menopause, what are some of the most common things they're sharing about intimacy and discomfort during sex?
I think sexual pain is a big part. I think the first thing we usually see is loss of desire. And that is super complex, right? Because a lot of us at midlife are juggling elderly parents that might need a lot of care. We also may be trying to launch children into the world. This is also a season where that career ceiling, we're really bumping up against that career ceiling. So it's a complicated time to then be overlaying a lot of hormonal change on top of it. So I just want to kind of hold space for there's a lot of psychosocial stuff going on while there's a lot of hormonal stuff going on. So a lot of women come in with low desire. I'm not sure if you've read Emily Nagoski's work. I am a huge fan of Emily Nagoski, but she sort of talks about how to feel desire, to feel your limbic system, the base of your brain, you kind of have to turn your frontal lobe off, right? And all of us are running around with our frontal lobe on 24/7, and we're not really diving into that desire part of our brains. So women, I guess to answer your question, women are coming in complaining of low desire. Many women, as the perimenopausal period continues into menopause, well, some of them will develop sexual pain, vaginal dryness, loss of elasticity, and then loss of sensation. They may have harder time reaching orgasm. It takes longer. And so it's a really challenging time to have these hormonal changes while we're having all this other stuff in our life that's also presenting a challenge.
Oh, wow. Actually, that probably leads us quite nicely into a question that we had from the audience. So, another first for the show is that prior to this conversation that myself and Polly are having, I reached out to my community, let them know that this was going to be a topic of conversation. And what were some of the most common things that perhaps they wanted to know about discomfort, sexual pain during perimenopause and menopause? And in actual fact, one of the questions that was asked was, let me find it here. How do I know if my symptoms are hormonal, emotional, or something else entirely? And you've just spoken a bit there about hormonal changes too. So, yeah, could I just turn it over to you?
Right. Okay. Really good question. Maybe not completely easy to answer. Okay.
Mm.
So, when you go to the gynecologist or your family medicine doc, if you have a healthcare provider who's been trained to look at your urogenital health, when things are starting to change based on hormones, sometimes we see the urogenital skin lose color. Okay. So, the inside, if you separate someone's labia and
Yeah.
you're looking at the vagina, it should sort of be pink and fleshy, like the inside of someone's mouth. Okay. And as those tissues lose estrogen, they also lose testosterone, they lose
Mm.
both, right? They will become really pale. They may kind of retract a little bit. And when you look inside the vagina, it should sort of have these beautiful folds. They're called rugae, sort of so that the vagina can stretch, right?
Okay.
And so you see loss of color, and then you see loss of the folds. The rugae tend to go away. So those
Okay.
are some physical changes that a healthcare provider could see on an exam.
Mm.
I do want to emphasize a lot of women may say, well, we could check my testosterone levels, and we absolutely could check your testosterone levels. I do want to emphasize that we don't have testosterone levels don't have a linear correlation with libido. So not everybody with high testosterone is going to have high libido. It's a little bit more complicated than that, right?
Okay.
Um, but I do think, particularly if someone comes in with a history of, hey, you know what, my partner and I were in a really good place, things were working, and my periods are now, I'm starting to skip periods, I'm starting to have night sweats, and it feels like when my partner was touching my clitoris, now it feels like they're touching my elbow, right? Then I would do an exam, I would get some labs and try to see, hey, let's try to replace some testosterone. Let's see if you need some vaginal DHEA. What else can we do for you to kind of get you back in the swing of things?
Mm. Really interesting what you were exploring there, because I think that also leads us quite nicely into another question that came from the audience too, which was about periods. So this person has asked, I am currently perimenopausal. Is it normal to experience pain even if I'm still having regular periods?
Oh, I love this question. This is such a good point. Okay. Perimenopause is like puberty in reverse. Okay. So maybe you remember back to when you started your period. Most of us didn't start our period at 12 or 13 or whenever. And it wasn't like tick tock on the clock every 28 days normal,
Mm,
right? It might have been you had a little brown sludge, and then 3 weeks later, you had a bright red blood period, and then nothing happened for 2 months, right? It was all over the place. You never knew what to expect.
mm,
This is the same thing. So we're having a wildly changing hormones. And so many women will experience hot flashes and night sweats while they're still having periods. They will experience bone loss while they're still having periods. Many women can have loss of vaginal hormones and still be having periods. So the absolute value of the hormones is relevant, but I
mm,
think what's more relevant is where are you coming from, right? So if your estradiol levels are at 50, but you were 300, that still feels like a huge drop, right?
yeah,
And another thing I just want to emphasize, vaginal hormones are super safe. Even if someone were a breast cancer survivor, American College of Obstetrics and Gynecology, a lot of our North American Menopause Society or the Menopause Society, we have guidelines in place that it is safe to give these women vaginal hormones.
okay.
So kind of we need to get rid of a lot of this fear on replacing hormones, because another thing that I think is so important is our urogenital health in terms
Mm,
of not getting urinary tract infections. Women on hormones vaginally decrease their urinary tract infections by half.
okay.
And so when
Mm,
we age, right, we see people get mental status changes from urinary tract infections, like all these other medical problems that are so preventable.
mm. So this fear that you mentioned, where is it coming from? Because I know that many women feel, or they describe feeling dismissed when they bring up sexual pain to their doctors. Do you think that because of that, that's what's causing some of this fear because it's just a lack of knowledge around it?
I think that doctors in general aren't getting good sexual medicine training. Okay. So, I mean, again, I trained 25 years ago, right? But I remember, and I'm an OB-GYN. So, right, we're supposed to be the vagina doctors.
Yes.
I think I got maybe 1 hour of kind of sexuality training, and it was a joke. The lady had like these two little pipe cleaner figures
Mm,
she was using. I'm like, are we in preschool? We're physicians. This is ridiculous, right?
yes.
So sexual medicine training that I did post residency training because I knew my training wasn't good enough.
Yeah.
And I think that unfortunately, I just don't think there's enough training. And I think that um, doctors are people too. And so we all need to bring our best professional selves to the
Mm,
office, right?
yeah.
But they've got hangups and early childhood garbage and social bias and all of those things that like we need to show up with our best selves, with our best information, and
Mm,
hopefully create an environment where everybody feels comfortable and discussing sexuality in a very non-judgmental fashion. And
mm.
unfortunately, I don't know that doctors are immune to some of the social bias that's out there.
Absolutely. And we are all about taking preventative measures or just planning for
Yes.
the future. So if this is inevitable, now for women, perimenopause, menopause, it's inevitable. But is painful sex during this stage of life inevitable as well? Or are there ways to prevent it or ease it early on?
Yeah. So I would say let's arm your listeners with this
Yeah.
information. So
Mm,
there is no need to have painful sex, right? So it could be that we want to make sure that we're not waiting until the doctor looks at our genitourinary system and sees that we've lost all of our color in our genitals,
mm,
we've lost all of the elasticity. Why are we waiting until people are in a crisis?
exactly.
Right? And so if you're 49, you're 50, you're starting to miss some cycles, you're starting to notice, you know what? I need to use more lubricant and the lubricant's not
Yes.
enough, right? Lubricant
Yes.
is just making things slippery. Hormones are bringing blood flow and elasticity to the tissues, right? So if you're having penetrative intercourse, you need elasticity, right?
Yeah. Yeah. Yeah.
So I would say, don't wait until it's painful. Let's be proactive and say, hey, I don't
Yeah.
want this to happen to me. Vaginal
Yeah.
hormones are very, very safe. Let's go ahead and get some, right? We're
Okay.
perimenopausal, we're late perimenopausal, we're missing a couple cycles. They're not expensive, they're
Hmm.
not dangerous. Why wouldn't we go ahead and do this?
Yeah. And of course, you have also just there, you're just talking so naturally and flowing that you're answering the questions as well that have come in. Because another question that came through was about lube. It was, I've been told to just use lube, just lube, but it doesn't help. Is there more that I should do to be looking into it? But I think you've covered it in terms of what you just said there.
Well, I would love to elaborate on this a little bit because I think
Yeah.
that you are in the UK and I'm not exactly sure. I know in the United States where I am, we don't do a really great job protecting consumers from things, chemicals and things that are in things that could harm us, right? And so the World Health Organization published over a decade ago something called osmolality guidelines for lube. But all you need to know is you want a lubricant that's osmotically balanced so it doesn't draw fluid out of your tissue. So, Good Clean Love is a brand that is osmotically balanced. Ah Yes is a brand that's osmotically balanced. A silicone based lube that's anhydrous would be
Mhm.
fine. So, like Uber Lube. Do you guys have any of these brands? I'm so sorry. I'm not very up on what's available in the
I'm not
UK.
sure, but I'm sure they can look on a shopping site and be able to see, or if not, there'll be an equivalent. I'm sure so.
Okay. So the type of lube you buy matters. I think silicone lube is easy because it doesn't have anything extra in it. All the stuff that heats up is probably not great to put on delicate tissue.
Hmm.
And lubricant only makes things slipperier. So it's not going to bring blood flow into the tissues. We want those tissues to plump up. One common misconception that I see a lot is confusion between a vaginal moisturizer and lube. Okay. So, lube is something that I'm putting on my body or somebody else's body so that when we rub our bodies against each other, it's slipperier. And that's
Mm.
great. There's nothing wrong with needing lube. And at any stage in your reproductive life, many people use lube inside and outside of menopause. Cool. Vaginal moisturizers typically contain something called hyaluronic acid. And hyaluronic acid is something that a lot of us midlife women are putting on our faces
Yeah.
to help with wrinkles. It's kind of making the tissues a little bit more fluffy. That can also help with sexual pain. I personally believe that hormones work a little better.
Hmm.
Um, but hyaluronic acid is something that you can use as a vaginal moisturizer. And that's more to sort of for day to day comfort. You're just feeling dry and uncomfortable. You could
Okay.
put that in like 3 times a week just for comfort, irrespective if you're sexually active or not.
Okay, that's really, really good to know because I think that's a lot of people's probably like a little bit of a misunderstanding around it or misconception around what you can actually do with the body and do it very safely. And I think that's what people are wanting to know that how can I do this in a safe way too,
Right.
especially because this can be quite an overwhelming stage of life for many people because it's also impacting on their emotions as well. And at the start of this conversation, you spoke about desire and the desire kind of being locked off a little bit during this stage. In what ways can we start to activate that desire again?
So I think testosterone is one tool in our toolkit. I
Yeah.
don't think it's the only tool in our toolkit.
Mhm.
So I'm very comfortable replacing women's doses of testosterone to physiologic doses.
Yeah.
So I think that can be helpful. There's a researcher who's actually Canadian. Her name's Lori Brotto, and she wrote a book called Better Sex Through Mindfulness. And she's done research. So she has an 8-week mindfulness based program that decreases sexual distress by 63%. That's
Mm.
better than any medicine we have out there. So now she has a Better Sex Through Mindfulness workbook. But I use that resource a lot with my patients about really, again, getting out of my frontal lobe,
Yeah.
getting into the base of my brain, right? So it could be really simple about slowing down and paying attention to how the sun feels on your skin. There are a lot of things that are beautiful and sensual about our day to day, but we're not holding space for those experiences, right? We're shoveling our food down while we're walking and we're on the phone. We're not smelling it and we're not experiencing the textures, right? We need to slow down and really engage our senses. So I like that Better Sex Through Mindfulness workbook a lot. I think that can be very helpful in conjunction with testosterone as another tool in the toolkit. Also, just really love creating space for not expecting sexual health or desire to happen spontaneously, right? So as a midlife woman, I'm much more intentional about what I eat, protecting my sleep, stress management, my relationships and who I'm hanging out with, right?
Okay.
So intimacy is probably going to require a little bit more time and attention than it did when I was 25, right? I could get in my skinny jeans when I was 25, no problem. Now I got to have a trainer, right?
Yes.
Everything takes a little bit more effort, but I think it's
Yes.
worth it. And I think our relationships are worth it. And I think it's a beautiful thing when we can look at our partners and say, hey, you know what? I really value this connection I have with you. Let's create some space so we can and make this a priority.
Yeah. And that connection with your partner during this time is so invaluable to have that support. So for people who listen to the show, because I also have, people of all genders who listen to the show, and also for the women going through this, how can partners offer meaningful support when women are experiencing this time of life and even experiencing pain, perhaps, without adding more pressure or perhaps even a bit of shame or embarrassment around it?
Right, right. I think this is such a good question because I see it from the clinician side of things.
Yeah,
Sex starts to hurt. The other partner is afraid to ask for sex. Everybody kind of goes in their corner and no one's getting out of their corner,
yeah.
right? So, are we allowed to speak very freely
You,
about bodily activities?
of course, yes, go ahead.
Okay, wonderful. So if penetrative sex hurts, what about a little oral sex, right?
Yeah,
Can we shift and find a different behavior that feels better while we're trying to work on the other thing, right? Can we broaden our definition of sex?
yeah,
And then also that I think sometimes women come to me and their partners are like, well, you saw the sex doctor, you're fixed, right? It's been one visit. She hasn't even gotten her prescriptions filled yet, right? You saw the
yeah.
sex doctor and you're fixed. So just kind of
Mm,
oftentimes this is layered, right?
yeah,
So we often start first with this hormonal changes. Can we put vaginal DHEA in the
yeah.
vagina? Could we use vaginal estrogen? Could we compound some topical testosterone? So we're fixing the hormone piece first.
Mm,
And then there might need to be some physical therapy. So you guys in Europe are much better about pelvic floor physical therapy than we are in the United States. You guys do this routinely after childbirth, and we're way behind you, right?
hey,
But many women would really benefit from pelvic floor physical therapy. So that's something that's going to take several months. So while all this is going down, it's such a wonderful time to say, thank you so
mm,
much for your effort about trying to get to a place where we can be together again and it can feel comfortable.
yes.
But what else can I do to make you feel good? And maybe we're not even going to do anything with your vagina right now, right?
Yeah,
What else would feel good, and to start that
mm,
conversation, right? Because there are
yeah,
probably things both of either gender or in any kind of relationship that any person could do for the other person that doesn't involve penetration, that might still be connection and intimacy, that might be fantastic and
yeah,
get people out of their corners, right?
yeah. That's really, really great advice that you have given there. And when you're speaking, it felt to me that there would be so much merit in actually partners going together to see a doctor, for example, or somebody like yourself, because to assume, okay, you've gone, you had your appointment, you're fixed, wouldn't it be more helpful for the partner to attend the appointment with the woman going through that?
Yes, I think that's a really great point. And I think it's a really good time that I will often look at the partner and say, I need you to understand that at a minimum,
Yeah.
it's going to take the vaginal hormones about a month to notice a difference.
Yeah.
Pelvic floor PT usually takes 8 to 12 sessions to notice a difference. So
Okay.
we need to have that very realistic set of parameters. And then if women are going to pelvic floor PT, I think that's almost an even better appointment for a partner to come to, because sometimes the pelvic floor PT can teach the partner what they're doing,
Okay.
and they can be kind of part of a helpful team rather than like,
Yeah.
we're involving them in the process,
Yeah.
right? So I think that could be really great. Obviously, we want to make sure that the person receiving the medical care is comfortable having yet another person in that room. But
Of
if she was
course.
comfortable with that, I think that could be a really great way to get some understanding,
Yeah.
right? Because if you don't own a vagina and they're like, you're going to go to vagina PT, that sounds really crazy to someone who
Yeah.
maybe isn't familiar.
Yeah. That's really, really helpful to know because I know that, for example, the partner can often feel quite isolated themselves when it comes to this process. So to have the opportunity, if that person feels comfortable, to have their partner involved, for them to feel empowered to be able to help, to maybe even see the blind spots in the woman who's going through this, and to be able to have a really healthy conversation around it. I think it's so important. And you've spoken about activities like the pelvis therapy. Now, of course, this is what can be done at that time, but it still feels like this is something, an exercise that we could be incorporating from. Why not embed this? Why not embed this from when we are very young in our teenage lives, 20s, 30s? Why not make this a habit? So when it comes to this stage of life, it's just normal and natural. Is
Right.
there a piece of education that has to be done at school level so that we now know how to actually embed good practices into our life when it comes to these body experiences?
Well, I think my take home point would be that sex shouldn't hurt,
Yeah,
right? And so sometimes when people are at the very beginning of their sexual lives, right, they may start off and have maybe they're not, I mean, a lot of us didn't have the greatest first
yeah,
experience with penis and vagina sex, if that's the kind of sex we have, whatever,
yeah,
penetrative sex or not penetrative sex, whatever. And, but I think sometimes it's normalized that this isn't comfortable, and that's we don't want to normalize that. And
yes,
so if at maybe pelvic floor assessment before pregnancy, maybe pelvic floor assessment during pregnancy, post delivery, right? This is another part of your body that we're just checking in on, that doesn't have to be kind of hidden away.
yeah,
um, but that we don't want women to sort of silently suffer and think that this is just the way it's going to be, right? I
mhm,
hear that. Well, isn't this just part of getting older? Well, I don't know about you, but when my kids are finally out of the house, I want to have fun with my partner,
yeah,
right? Like we've done the hard work. Now it's time for some fun. Let's go.
yeah,
So um, there's no need to have painful sex. We can usually find a resource. And certainly we know that unwanted sexual contact is far too prevalent and far too common. And sometimes this is a really complicated emotional, spiritual, there's a lot of healing that needs to happen. But so I don't want to downplay that or not hold space for that pain.
yeah.
But medically, we should be able to correct genital urinary syndrome of menopause. Medically, we should be able to correct pelvic floor hypertonus where the muscles are too tight, right?
Yeah.
We want women to know that there are solutions, and that there are a lot of people out there that are trained to help them, that want to help.
And that's one of my points I was going to ask you, because for anyone listening to this who is struggling in silence or they feel really unsure about speaking up, what would you say to them? Like, where is a good place to start? Is it from
Hmm.
seeing somebody like yourself? Where did they go?
You know, I would love to say that every OB-GYN, kind of the person that delivers the babies, is going to be well trained and well versed and hold non-judgmental space. There is an organization called the International Society for the Study of Women's Sexual Health. It's called ISHWISH, and they have a website where you can find a provider. And so that's a great resource. So if you could find someone who's ISHWISH certified, that would be amazing. Hopefully, a menopause certified practitioner would also have some overlap with this, but maybe not quite as much. So that website would be menopause.org. And that's a North American organization. So that's not just specific to the United States.
Okay.
And then the third resource, and I will be really honest, sometimes I feel like we get more help from not MD level people, but sometimes the physical therapists, right? Sometimes they have a little bit more time to spend with people, et cetera, et cetera. So in the US, we have Herman and Wallace, who is a teaching organization for pelvic floor physical therapy. And so on their website, they have a find a practitioner. So that would be another place to look at, like, if you Google, pelvic floor PT near me, you can always usually have a session with someone and kind of explore, what does this look like? Is this appropriate for me? But that can also be another really great resource.
Thank you so much for sharing that, because I know for a lot of people, they are often going down the insurance-led route. And I know that you've spoken about this and how sometimes it just feels like a tick box exercise when you go down the insurance-led route. So for people listening to this show, for you, what felt limiting about that system? And now that you are specializing in functional medicine and the more holistic ways, what differences are you seeing there for people who want to see the comparison and they're like, I don't know, functional insurance, I don't know, what's the difference?
Well, I mean, being outside of the insurance-based system, I have a much more, I can control how much time I spend with my patients. So, right, that's the biggest thing for me, is that, prior to this, a new patient appointment might be 20 minutes, and now a new patient appointment is an hour, right? And so I have a lot more time. When I'm outside of the insurance model, then I'm not necessarily, like you're saying, checking boxes. So it's not that, like, screening about if there are firearms in the house. It's not that those things aren't important. It's just that that's not what that patient came to me for. So I'm not working for the insurance company. I'm working for my patient directly. What are you here for? What do you need from me today? I'm going to focus on that, rather than, like, we hit these metrics that a bean counter decided that we needed to hit. And so I think the greatest gift is time, because our the most important job we can have is to listen, right?
Absolutely.
I mean, there's a lot of healing in just people being able to share their story and feeling heard and seen and respected. And so having that time is really invaluable.
Yeah, so important, because at that time you're then able to do that thorough assessment on somebody. So you can look at supplements, I suppose, you can look at nutrition, mindfulness, lifestyle changes. So if somebody was to reach out to you, for example, how do you work out what's going to be the right combination for somebody in terms of all of these different options that they have? And it's probably quite a lot because it's very individual per person, but you might have some method that you use.
Yeah, I think that we often go back to what the patient's first goal is, right? So kind of like a hierarchy of things that are affecting their life.
Okay.
And also, what does their life look like, right? So I had a patient earlier today who's a breast cancer survivor, and she's undergoing radiation therapy right now. Her energy level is going to be down. She's got a lot of doctor's appointments. So a huge part of our conversation today was, what is a fire that needs to be put out right now? And what is something else that we're going to follow up? We're going to keep our eyes on. But what is the most healing thing for her? How can I support her during radiation versus making her more crazy and going a lot of different directions? And so oftentimes the conversation is how much bandwidth do you have to give to lifestyle medicine? How can I support you? And then, we often start with sleep, right? Because especially thinking about desire, a lot of us are exhausted at
Yeah.
midlife, right? And if we're waking up 3 times a night with night sweats, or we're waking up because we're caring for maybe an older parent that's in the home, if you are exhausted, you're not going to want to have sex. You're not going to want to have intimacy. So sometimes we might even say, okay, intimacy is your first goal. Got it. But you're not sleeping. So I need to figure out a way to help you sleep so that we can get to that extra
Yeah.
part. So we're sort of working as a team to figure out what's your bandwidth, how many resources do you have to devote to this, and then what's the most important first step. And oftentimes sleep is the first step.
Yeah.
um yeah.
Yeah. That's, oh, I love what you're doing there because you're actually looking at the goal and the outcome there. And I suppose that's so much a difference when you can give that time to the person who is seeing you. Because, and this is great for the audience, for the listeners, is to actually figure out, what is your goal? What's the ultimate goal? And then you can start to reverse engineer it. You can start to peel back and start to explore, okay, so what's happening with your lifestyle, your mindfulness? What are you doing with your time? What are things that you can actually drop and insert back in a very healthy way? So I love the fact that you explore that with the people that you work with. And I know that you are so passionate about helping women to see the optimism around this stage of life too. Could you spoken there about the children maybe leaving the home? Great, you got more privacy time with your partner. So what are some of the upsides? Because no, we're talking about pain, we're talking about discomfort, we're talking about maybe a loss of intimacy. But what are some of the upsides that women might not always realize are waiting for them at this stage?
I feel like I have a little cartoon on this. Puberty was the first time you had puberty. You didn't have a lot of autonomy. Maybe you weren't
Oh,
that smart yet. You didn't really know how to ask for what you want. You probably didn't
mm,
even have a language for that. And now we're at the second kind of puberty. We're at the second transition point, but we're armed with autonomy, right? A lot of us have a lot more self possession and choice. We know what we want, and we're finally mature enough that we're really able to ask for it a lot of times, right? I think we also have this beautiful thing I think happens when you turn 50 where you just don't care what other people think so much.
yeah,
I think there's a lot of beauty in that, right?
yes.
And and I think from a sexuality standpoint, when we were younger and coming of age, we hadn't figured out what we liked sexually, what we wanted sexually. But now on this side, we have, right? So we
Mm,
have some autonomy, we have resources, right? Sometimes we can get away from the piles of laundry and have a weekend away, and we know how to ask for what we want. And so I think this is a great time to sort of have another metamorphosis of what is my best second half going to look like?
oof.
Because now I have the tools in my toolkit to get it.
How empowering. I love that. What's my best second half going to look like? That's a audience, listeners, be taking notes because that's such a powerful question to ask yourself because it puts you into the state of ownership and, as you said, autonomy and the ability to just stand in our power, to stand in our truth. I'm 41 and I'm sure at some stage I'm going to be hitting perimenopause. Of course I am, but I don't know how soon it's going to be. As you said, your mother hit hers at 38. So, 38, it can come at any time. But I love that question. And if, for example, even if you haven't hit perimenopause quite yet, there's still an opportunity for us to sit down and figure that out and start to even embed that into our lifestyles right now.
Right. I mean, I love kind of taking up some space for yourself, right?
Yeah.
And so, as we're making this transition where intimacy may have some challenges, metabolic health may have some challenges, it's a little easy to put on some weight around your middle when you're not doing anything different. We lose some muscle mass, all these
Yeah.
things. Perimenopause is the time to be like, okay, I found the gym. I'm learning how to lift weights. I I found some yoga or meditation or some sort of active stress management, right?
Mm,
It's the time to be like, sugar and alcohol are not your friends, right? We are really going down with the protein and the vegetables, and
mm,
we're going to celebrate it. There are tons of ways to make healthy foods taste amazing.
yes.
But perimenopause can just be like, let's almost like, women do a lot to prepare for pregnancy, I would kind of think about, let's prepare for this better second half. I'm going to get everything kind of honed in, because the women that I work with that are, they're exercisers, there's clean eaters, they're protecting their sleep, they're setting boundaries in their relationship, they don't work 24/7, right?
Yeah.
These are the women that go into and have such an easier transition.
Mm.
They've already got those resources in place.
Yeah, absolutely. So preparation is great, to be able to prepare yourself, be proactive rather than just purely reactive. Proactivity over reactivity. I love that. There can be such a powerful combination. So before we kind of weave a little bit more into relationship sides, because as part of my show, I do like to speak to my guests about some of their experiences when it comes to their own personal relationships. Is there anything that you would like to leave the listeners with on the topic of sexual pain, hormones, all of those kind of stuff before we actually weave into the next part?
I just want to say that there are a lot of ways we can help women with sexual pain. So if you've mustered up the courage to bring this up to your healthcare provider and the first option you were given didn't work, please don't be discouraged and stop. You may need to find another healthcare provider that has more tools in their toolkit, but there are many, many tools. And so we never want you to accept that this is as good as it's going to get. You deserve better. You deserve to have pleasure. You deserve to, I mean, it makes me crazy when we're like pain-free sex. No, you deserve to have great sex,
Mm,
right? So pain-free is not enough. Let's make this right. Again, you're in midlife. You know how to ask for what you want.
yes.
Now's your time.
Oh, brilliant, brilliant. And it's actually putting your energy into what you want rather than what you don't want. When you say pain-free sex, it's kind of like a focus on the pain in a way, isn't it? The language that we use is so important, but we just want great sex during this time. I love that reframe. It's so powerful. So for my listeners, I know they absolutely love this part of the show too. It's when I speak to my guests about some of their relationship lessons and learnings, past, current. So when you're thinking about and reflecting upon your relationships, either past or current, what would you say have been some of your key learnings and experiences from that?
Well, this week I celebrated 25 years of marriage. So that
Congratulations.
feels like an enormous amount of time. But I'm from the southern United States where we grow peaches in Georgia. And when I met my husband, I told my mother, I said, it's the difference between fresh peaches and canned peaches. Um, it's just a different food.
Yeah.
I think the thing that Ben taught me is that he accepted me as I was, right? Rather than expecting me to be the version of me that was in his head, right?
Mm.
And so I think that that's been really lovely.
Yeah.
That just felt so different than any other relationship that I'd experienced.
Mm.
And I think the other thing, just to kind of harken back to like, how can partners support women going
Yeah.
through this transition? One thing that I'm a spaz, right? I have a lot of fire in me. I'm a little inflammatory. I get a lot done, but I'm kind of loud, right? So
Yeah.
it can be a lot sometimes.
Mm.
And if I'm having kind of a rough day and I'm throwing a lot of darts, so to speak, instead of like, saying, hey, you're being a real jerk today, Ben responds with curiosity and compassion. And so he'll kind of say something like, hey, did you have a rough night last night? How was your day at work? So instead of like saying, you're
Mm.
being a real jerk right now,
Yeah.
he's responding with curiosity and compassion. That's a really gentle way of letting me know that maybe I could tone it down a bit, right? Or sometimes he'll say, when was the last time you went to yoga? I bet that would feel really good right now, right? So another thing that he does that I think is really lovely is, are you taking enough time for yourself? We all need that. And so I have two teenage boys. And so everybody, like, when mom is mean, like, mom, just go to yoga. So when
Yeah.
I say I'll do yoga today, everybody's like, we love you. Thank you, yoga. Right.
Yeah.
So, you know, responding to the other with compassion and curiosity rather than judgment is such a huge gift. And I'm really grateful for that. That has been very different than any other relationship I had before this one.
Oh, I love listening to that. Go Ben, because you go Ben. Everybody clap for Ben because he seems to be doing such a tremendous job when it comes to awareness. Is that awareness without judgment, without attacking you, without actually withdrawing? What he does is he leans into your experience and he is there with curiosity, with some, hopefully at the time, helpful suggestions as to what might best serve you. Now, even your sons, like go do yoga. So it's that me time. I say me time and we time. It's that separation that allows you to just be. And I absolutely love that learning. I absolutely love it because I think it transitions so well into how healthy relationships ought to operate anyway, too. And I always say when somebody actually leans into your partner, it's that gratitude, it's that appreciation for your partner too, isn't it? To kind of be like, hey, yeah, you called me out and I like that. Thank you very much. Thumbs up, go Ben. So really celebrating Ben and that. So, talking about love as well. Polly, what is your personal definition of love in a romantic front? What does love mean to you?
Well, I'm a huge nerd, so I'm going to come into what came into my mind when you asked me this last week.
Yeah.
And in my mind, love is holding space for the other person to be their absolute true and authentic self
Mm.
without any self-interest. So even though that sounds very separate, my version of love is really allowing that person to blossom and shine, irrespective of what I expect them to be.
Mm.
And that's what I feel like Ben does for me.
Yeah.
And I feel like
Yeah.
I strive to do that with my children. I don't know that I always do, but it's a work in progress, right?
It is. And when you were speaking there, it just made me feel like Ben, and also it probably works both ways. You've created a space where both people can feel safe. And I think ultimately safe to be myself, based to show up as my most authentic self and just be. And that's so important. That whole safety, us humans, we thrive on safety, whether that's emotional safety, whether that's physical safety, whatever safety that might be, we thrive in that. And your personal definition of love there really makes me feel like you guys have created a safe space. And that's beautiful. That is absolutely beautiful. So thank you for sharing that. It wasn't nerdy at all in terms of what you said. That was really deep and profound. So thank you so much for sharing. So I would say that we have covered so much here. In actual fact, because you were so in flow with the conversation, the audience questions that came through just fitted in so naturally into the conversation. So thank you for addressing that because I know the people who are listening are going to be like, yeah, great, I've got it now, which is fantastic. I absolutely feel that we have provided a really great toolkit for people to start to explore this time of life, whether you are in it, whether you are coming up to it, whether you're way not near it at all. You now have some great first steps to be able to take to understand more about that. So, Polly, I really thank you for sharing your knowledge and your wisdom and for helping people to lean into this experience as well without fear, but more hope and optimism. So thank you so, so much for that. Now, before we go, I do have a parting tradition on this show, and that is for my guests to leave our audience with one key takeaway to help them along their journey of love, well-being, and relationships. And I would love for you to share something with us.
I think menopause transition is this fantastic opportunity to start putting yourself first.
Mm.
I feel like women are always putting themselves behind their partners, their job, their kids, whatever. This is a time when your health requires more of you, more time, more resources, more energy.
Yeah,
You are worth it. You deserve this, but it's time to put yourself first. And it's not selfish. It's necessary.
yeah. What a great takeaway. Absolutely agree with that. Polly, where can people reach out to you? Where are you hanging out? I would love for you to be able to let people know where they can just follow your work, reach out to you if they feel really cool to doing so.
So we have a podcast called Menopause Rescue. So that's available wherever podcasts are. And then I am located in Raleigh, North Carolina. We do see patients virtually, but right now we just have a license to practice in North Carolina. So I can serve people in North Carolina. And my practice is called Hormone Wellness MD. And I have a great nurse practitioner named Kate Willis. So we're a little duo there, and that works out great.
Brilliant. I have seen a few of your Instagram reels where you guys have joint forces, and they're great. They're a great combination. So I'm going to drop all of your contact details into the show notes so people can easily access that. And I really want to thank you again, Polly, for your time today, for your knowledge, for your wisdom. Thank you so much. It's been tremendous. Thank you.
Well, thank you so much for all that you bring, and then your big, warm heart and helping people heal their relationships and find better ways to connect, because that is such a gift.
Thank you. Thank you so much for your kind words. And for everybody who has listened to this wonderful episode, I want to thank you for your time, for your attention, and for your energy. And until the next episode, take great care of yourself and others too.